Everyone, Adam here with another video, this time about patellofemoral joint pain. Today I'm using the microphone on my headphones in the hope that it gives us a little bit of a better audio. If it doesn't, let me know in the comments below and I can always change back to what I was doing before. So let's get started. What is patellofemoral joint pain? Well, patellofemoral joint pain is a term used to describe pain towards the front of the knee around the kneecap. This pain often comes on without really much of a mechanism of injury, it just tends to come on over time. Patellofemoral joint pain can affect any age. It mainly just affects more active people and generally is linked to a bit of a change in activity levels, but not always. So patellofemoral joint pain is something we describe as a mechanical issue rather than a structural issue. That essentially means that if you were to have any x-rays or MRIs, any sort of imaging on the knee, it would come back generally as pretty normal or without really anything of note. And that's because there's nothing that's damaged, no tissue that's broken, no ligaments that are ruptured, nothing like that. But what it is when you're moving, the mechanics of the movement are causing the pain. Since an MRI or an X-ray just takes a still image, we can't really see that movement and can't see what's causing the problem. The best way I've found to describe patellofemoral joint pain is essentially you've got your two bones that make up the knee. You've got your femur and the thigh, and which forms the top of the knee. You've also got your tibia, which is your shin bone, which forms the bottom part of the knee. And both of these bones come together to form a sort of hinge joint like this. The reason it's called patellofemoral joint pain is because you get pain around the kneecap, which is the kneecap is called the patella, and the end of the femur, hence the femoral part of the name of the condition. And essentially what is happening is at the end of the femur, as it comes towards the knee in that knuckle, in that joint, it's shaped a bit like a knuckle. And what happens is there's a groove in between those two in that knuckle there, which is where the kneecap sits, that's where the patella sits. And what happens is that as you bend and straighten the knee, the patella goes up and down in that groove. And if there's any lateral movement or a movement that's not the normal movement in there, and say it takes a bit of a funny path in that groove, then that's what causes extra stress in that area, and then that's often what gives you the pain. So what causes that abnormal movement of the kneecap? That's often been a bit of a talking point really amongst the research. It initially was thought that towards the end of the quadricep muscles in the thigh, there's part of that muscle that's towards the inside of the knee called the VMO. It was initially thought that that was the cause of the problem. If that wasn't strong enough, then that was allowing the patella, the kneecap, to drift. More recent research has shown that it's more towards the hip, so the hip muscles that bring your leg out to the side, which are called the hip abductor muscles. If they're not quite strong enough, essentially what can happen is that then means they get a bit tight, and that pulls on the IT band, which again can sort of pull the kneecap to one side, is because the IT band goes down the outside of the thigh and attaches into the outside of the knee. Again, more recent research is swaying back towards the VMO being the problem, so actually it could be either. Generally speaking, the approach that I like to take is that it could be either the weak VMO or it could be weak hip abductors. So generally I'll arrange or plan my treatment to treat both of those, just to cover both bases. So in regards to physiotherapy treatment options, the first port of call and the main treatment should be surrounded around exercises. Exercises to work on that VMO muscle, working towards the inside of that knee, working on those quadriceps, and also working on the hip abductor muscles to work on that strength, to make sure they're strong enough to support the knee from the outside. You can also have other treatments if the pain is particularly severe and say the exercises were quite difficult because of the pain. You can have things like acupuncture again and sports massage. Again, they're not going to solve the strength problem. They're going to help with managing the pain and bringing it down so you can get more out of the exercises and maybe do those extra few repetitions so you can build up that strength. But I wouldn't use them on their own. They're not going to build up that strength, and ultimately the problem will come back if that's your only treatment. Another short-term option to manage pain could be taping. Taping is a little bit less consistent in the results than something like acupuncture or sports massage. taping, the approach you would take is to try and lift and support the patella, the kneecap, so that it's got less pressure on it. Again, the evidence is pretty varied. In my experience, some people find it fantastic, some people don't. Generally, the approach that I have is that it's not going to cause any harm, so give it a try. If it works for you, then we can use that as an option to try and manage the pain while it's getting better and we're doing the exercises. If it means that you can do a few more repetitions and get that strength in there, then as far as I'm concerned, it's a good approach to use. If you want me to show you some techniques on how to tape the kneecap, it's pretty straightforward, but I'm happy to make a video on it. Just let me know in the comments below. How long does patellofemoral joint pain take to get better? As usual, it's pretty varied from person to person. It depends on two main things really. It depends on the strength that you've got at the moment, and it also depends on the demands that you need to meet. So for example, if you have someone who is pretty weak because they don't do any exercise, but actually they don't do any exercise, they don't need that high capacity, they work at a desk but they don't do any exercise outside of that, and they're a healthy weight, generally the capacity that they need isn't too high, so you can reach that a bit faster. But then if you've got someone, for example, that has a very sedentary lifestyle, sits on the sofa, doesn't really do an awful lot, and then suddenly has decided they want to take up running, their strength is down here, but their capability or the capacity that they want is up here, and you've got to bridge that gap. So generally the best thing to do is to try and improve that healing and get back out of pain quicker, is avoid things that are going to aggravate it. If it's that second example, for example, stop them from doing exercise, or not necessarily exercise, but stop them from running, just in the short term, because it takes the load off the knee, gives it a chance to build up that strength, and then keep going with the exercises, but then slowly build up the running alongside, rather than just jumping in at the deep end, causing that pain because the knee can't cope with it. I hope you found this video on patellofemoral joint pain useful. If you have, please leave a like and subscribe as well, and anything you want me to do in the future, please leave a comment and let me know. And also if you found the audio a bit better, also let me know, and I can use this setup in the future. Thanks everyone, and see you in the next video.